Dr. Sebastian, thank you for taking time to talk to us today. I do have a few questions for you. What is the DNP and why would I want to earn this degree?
The DNP stands for the Doctor of Nursing Practice. It is a professional practice degree, and it's really designed for nurses who love the clinical environment and love practice. This particular movement toward professional practice degrees is occurring in other fields as well. For example, today, pharmacists are prepared with the PharmD. We know that physical therapists are prepared with the DPT, and other professions as well are prepared with practice degrees. Now, these particular degrees do not prepare physicians, that is the MD, but this levels the playing field in the clinical environment with clinicians who have practice degrees. One of the conceptual reasons for the development of the DNP is the increasing complexity of the clinical environment. Our aging society, increasing globalization, increasing diversity, huge scientific advances in the areas of genetics and genomics, informatics, to name just a few, have prompted us to rely more heavily on evidence-based practice, while at the same time we are relying on tailoring and creating even more individualized approaches to clinical care. So it's a complex time, and doctoral preparation is a real advantage for nurses who are interested in that.
What is the difference between the DNP and the PhD?
The DNP is the degree for advanced clinical practice. The PhD is the degree for preparation of nurse scientists. Curricula in both types of degree programs differ pretty dramatically, so we can educate students with the skills and the knowledge that they need for the particular goals of that degree program. So, for example, a DNP curriculum includes coursework in areas such as epidemiology, outcomes, leadership, policy, all of the kinds of tools and techniques that a graduate would need to improve practice, whether at an individual organizational level or at a broader systems and policy level. PhD programs prepare nurse scientists with curricula that include heavy emphases on theory building, research design, data analysis, and a whole variety of analytic methods.
Is one degree better than the other?
No, that's a wonderful question, and people often ask that. Both degrees are considered terminal degrees in the field. What that means is it is the highest degree that one can earn in the field. So if a nurse wishes to move in the direction of becoming a scientist, the PhD is the terminal degree. If a nurse wishes to move in the direction of the highest level of advanced clinical practice, the DNP would be the appropriate degree. Both degrees are critical for the development of our field and, more importantly, for the promotion of health for the public. In fact, we hope that as we see more DNP graduates entering the marketplace, that PhD graduates and DNP graduates will work together to improve practice, with the PhD nurse scientist generating new knowledge and the DNP graduate bundling that knowledge into programs, guidelines, and practices that improve health care. We also hope that both sets of graduates work very, very well in interprofessional teams with other individuals.
Can nurses with a DNP accept a faculty position?
Yes, as a matter of fact, it's very much to the advantage of schools of nursing to hire nurses with a DNP degree, because these nurses are prepared with such high-level clinical expertise. Now, the policies and needs of each school may vary, and so the opportunities vary based on the mission of the institution and on the kinds of openings that are present. Both DNP-prepared graduates and PhD-prepared nurses need to take additional coursework in education, nursing education, in order to prepare them for faculty roles. But both bring unique sets of skills to the teaching environment and add substantially to the kinds of experiences that students will have.
Can nurses with DNPs do research?
You're asking so many good questions. I'm really very excited about it. Nurses with a DNP are prepared, again, as advanced level clinicians. They're prepared to take research findings and put them together in coherent types of programs, clinical protocols, a variety of practices that will improve care in the clinical environment. Then they will evaluate the outcomes of those protocols or programs or new practices and determine what works well, what needs to be improved for the future. Whereas nurses with a PhD are generating original knowledge that is generalizable broadly, and we would say that that's externally generalizable. So PhD prepared nurses are prepared to do the original research. DNP prepared nurses are prepared to use that research and then to evaluate effectiveness in a local environment. So if we think of inquiry as a continuum, the PhD prepared nurse is generating broad level knowledge using very focused research skills. The DNP prepared nurse is evaluating the impact of a program in a particular local environment. So the skills and the focus of those efforts vary.
Is the DNP only available to nurse practitioners?
That's another wonderful question, and it's often a source of confusion. And the answer is no. The DNP is not available just for nurse practitioners. Many programs, such as ours, admit only advanced practice nurses. That encompasses the four major roles that we think of as advanced practice nursing: nurse practitioners, clinical nurse specialist, nurse midwives, and certified nurse anesthetist. Other programs admit students into a nursing executive track or into areas of emphasis with nursing informatics or public policy. So these programs are not just for nurse practitioners at all. Here at UMSL right now we're admitting only advanced practice nurses. In the future we may broaden our program beyond that.
Well, thank you so much for your time today. And if anyone has any further questions, we would refer you to the link on the website where you can contact one of us directly.
Thank you.